Not explained, really? Then what is unexplained infertility? Unexplained infertility is like trying to solve a puzzle without all the pieces. You and your partner may be in good health, everything seems fine, and yet conception seems elusive. It gets frustrating and it is very confusing, and you are downright disheartened when it is not happening, not working despite all the effort, right? So if you're resonating with this, then let's go into a little bit of details. Hello everyone, myself Dr. Indu from Samruddh Fertility and Urology Center. Today I am going to dive into a topic that's quite mysterious, that is unexplained infertility. So in the medical terms, first let me explain what is infertility. It is diagnosed when a couple is trying to conceive for at least a year without having any intercourse difficulties, having intercourse regularly but without success. Remember, one should not have started any tests also. So this is called as infertility. Now, the standard tests done in such a situation are: number one is the pelvic scan to know the uterus, the ovary and its reserve. Number two is semen analysis to know the count and motility. Number 3 is fallopian tube test to understand if it is patent, and rarely we may do a hormone evaluation. If all the 3 tests comes normal, then we know there is no abnormality of the female or the male reproductive system. Then it is called as unexplained infertility. So this diagnosis definitely feels like one has reached a dead end in the journey of parenthood with no clear explanation as to why this pregnancy is not happening then. So the diagnosis is basically by exclusion after doing all the standard investigations. At this point, I want to sensitize you all with one reality that I commonly come across or I experience. Do you know what's that? Couple actually, when they start to try, they would not have tried long enough. Maybe try for a month, 2 or 3, and they start with investigations and see the doctors. They are really in a hurry, they get impatient, and I feel they get into this trap of anxiety and restlessness. So please avoid this unless it is advised by a doctor. In the absence of any identifiable cause, the management of such a situation, that is unexplained infertility, becomes very traditional and empirical, and one has to decode step by step in the management of fertility. So how do we go ahead with the management then? Suppose the woman is falling in the younger age group and all her tests are normal, then we counsel the couple to try naturally for some more time. But then, however, if the woman is falling in the older age group, say she is more than 33, 34 or 35 years, then here is one important fact, that the age of the female partner influences the pregnancy rate that is associated with the expectant management, that is the natural way of achieving conception. So why does unexplained infertility happen? If we don't know, if we are not able to find out the cause, well, the truth is that the medical science has not cracked this nut yet, because it's a combination of many factors. It could be a subtle hormonal imbalance, it could be an undetected or a hidden issue with the equality or issue with the sperm function. So it is like searching the needle in a haystack with no guarantee of finding it. Here at this point, let me share some of the tips. If your menstrual cycles are very regular, then you don't need to do any ovulation studies. It's not really recommended. But then if it is needed, then yes, you can do the test by urinary LH measurements. You can get an ultrasound monitoring, follicular monitoring done by the fertility expert, or you can get the mid-luteal hormonal progesterone hormone measurement done only if it is advised by a doctor. Then the testing of ovarian reserve in detail is not required as test to know the cause of infertility when you are trying to achieve a pregnancy in the next 6 to 12 months, unless you fall into the older age group, that is, say if you are more than 34-35 years of age. But here is a relief for you all. Just because it is unexplained doesn't mean it is not solvable. Pregnancy, if not achieved for a long time, say in a younger couple for more than 3 years, and in older couple for more than a year, and one has tried simpler treatment, all that has been attempted, then it is better to consider higher fertility treatment after consulting your fertility expert, because remember, taking a higher treatment at the right time is very crucial for having a successful pregnancy outcome. This is very important. Now the other options are definitely, the lifestyle factors that should not be ignored, and also addressing one's psychological aspects. These also has to be taken into consideration. So it's like opening a new chapter in your journey with lot of hopes and possibilities. So in the end, I would want to say that if you are someone who is having this challenge of unexplained infertility, know that there are many who are sailing in this same boat. Reach out to the trusted healthcare provider who is an expert in the fertility. Take charge of your fertility journey and explore all your options. Understand about all other treatment. Remember, infertility is just one phase of your life and not your entire life. Have that faith, stay resilient, believe that the happy ending is going to come soon. As I said, unexplained infertility is mysterious and it really requires a lot of patience, and my sincere advice to you all is to not to lose the patience. Have a lot of patience. If you have liked this information, then can I ask you to share this link with the ones who need this so that they also get clarity. So let us break the silence, break the stigma, and let us break through a brighter tomorrow, because every woman deserves the chance to build the family of her dreams. Thank you for watching.